Welcome to the first section in Chapter 16, titled Scene Safety. As always, with you today it's Keith Woodmeyer from Wayne County EMS. So let's get started here and pull up my notes. Alright, we're going to start with the scene size-up. Scene size-up is the first phase of a patient assessment and is made up of 5 points. First, we have standard precautions, which again, that's our BSI. That's making sure we are wearing what we need to keep ourselves safe. Second is evaluating scene safety. Is that scene safe to enter? Third is determining the mechanism of injury or the nature of the patient's illness. Fourth is determining the total number of patients. And fifth is determining the need for additional resources. Scene size-up begins with the information received about the emergency. The information the caller gives the EMS dispatcher may help you determine the location of the emergency, if this call is trauma, such as an MVC, or a medical complaint, such as a seizure. The number of vehicles involved, the number of patients involved, the age and gender of all patients, when the emergency occurred, if the call involves fire or other potential hazards such as leaking materials, downed power lines, broken gas lines, hazardous materials, violent patients, or dangerous pets. Excuse me. If law enforcement or fire department personnel are on the scene, if advanced life support personnel have been sent to the scene, if special resources will be required, such as hazardous material teams, confined space teams, water rescue teams, extrication equipment, or air medical transport. In wrap of the scene, it's important to consider what additional help you might need on the scene. Do you think you might need law enforcement? What kind of things would you need law enforcement for? To go from crowd control, vehicular safety, roadway safety. Do you need fire department for extrication, for fire suppression? Do you need the utility companies for gas leak, water leak, down power lines? Do you need advanced life support personnel for significant chest pain, for significant respiratory complaints, significant trauma? How do you gain access to this patient? Do you need rescue or fire department equipment? What questions will be important to ask the patient or the patient's family? As always, it's important to take standard precautions on every call. Every call must minimally have gloves. You may need to include masks, goggles, gowns, whatever the scene may call for. Study the scene before you approach the patient. What potential hazards may be present at a crash or rescue scene? Looking at this scene here, does this look safe? Is that vehicle safe to go near? That will be once fire personnel stabilize the vehicle, but just arriving on the scene, that may not be a safe scenario for medical providers to go into. Consider all the following questions at a car crash or rescue scene. Is the area marked by safety lights or flares? Is traffic controlled by law enforcement personnel? Does the vehicle, aircraft, or machinery appear stable? Do you see any leaking fluids? Are down power lines present? Do you see fire, smoke, or potential fire hazards? Do you see any entrapped victims? What potential clues may be present at a hazardous material scenes? Leaks, placards. A driver may be able to inform you. They may have Chemtrec paperwork. At a scene involving toxic substances, obvious hazards may be present. At other scenes, the hazards may not be so obvious. Look for clues that suggest the presence of hazardous materials. Placards on railroad cars, storage facilities, or vehicles, vapor clouds or heavy smoke, unusual odors, spilled solids or liquids, leaking containers, bottles, or gas cylinders, chemical transport tanks or containers. Park at a safe distance upwind or uphill from an incident. Contact your local hazardous materials response team immediately. Do not enter the area unless you are trained to handle hazardous materials and are fully protected with the proper equipment. Do not walk or drive an emergency vehicle through spilled liquids. Keep unnecessary people away from the area. Provide emergency care only after the scene is safe and the patient is decontaminated. Only practice within your scope and training. Emergencies in confined spaces are low in oxygen. Some of these include mines, wells, silos, or unreinforced trenches. Rescues in these situations require specially trained personnel and equipment. Do not enter the area unless you have all the necessary equipment and have been trained in this type of rescue. What clues would suggest a possible crime scene or a hostile situation? It's important to assess the potential for violence. Look at this entire scene. When you walk into the house, are there broken things? Does it look like somebody came through and there was a fight? Do you see blood? Do you see debris? What do you see when you go in? Clues include knowledge of prior violence at a particular location, evidence of alcohol or other substance use, weapons visible or in use, loud voices, fighting, or the potential for fighting. Assess the crowd and look for hostile bystanders. Never, ever, ever enter a potential crime scene or scene involving a family dispute, a fight, an attempted suicide, drugs, alcohol, or weapons until law enforcement personnel have secured the scene and declared it safe for you to enter and provide patient care. Do not go into an unsafe scene. You are setting yourself up. Consider the environment before approaching the patient. If surface or slope is unstable, or if water, ice, fire, or downed power lines are present, call for specially trained personnel as needed. Do not enter a body of water unless you have been trained in water rescue.